A scrub brush is then selected and opened up. The scrub brush contains a brush and a pick for removing contamination from under the nails. Take care not to discard the packet and the pick in the sink and place them instead in the bin. Firstly, the hands are wet right to the level of the elbows. And then the nails are cleaned. In the wiper center, the water is activated by the leg while scrubbing. Remember that contact time of the chlorhexidine material is the most important aspect of the scrub, and there should be about 5 minutes of contact prior to donning of gloves and gown. Once the nails are clean, the brush is selected, and chlorhexidine solution should be applied right up to the elbows. The soft part or sponge part of the brush is used to apply material to the arms, the forearm, and up to the elbow, and the brush itself is used to clean the hands. The reason for this is that there are many bacteria living in hair follicles and pores, and excessive scrubbing of the forearm can lead in fact to greater contamination of the surgeon. You should always check the clock prior to beginning the scrub so that you know that you've scrubbed for the appropriate length of time. There are a number of ways to scrub, but essentially a systematic method covering all areas should be used. Many surgeons choose to make the hand into a 4-sided structure and scrub each side 10 times and then repeat the procedure. There's enough chlorhexidine solution within the brush to allow a full scrub to take place. If at any point the operator touches the wall or the tap or anywhere on themselves, the scrub should be begun again. At the end of 5 minutes scrub, water is washed from the hands, starting at the hands, and so the water runs down to the elbows. The hands should be kept upwards so that any dirty contaminated water runs down away from the clean hands, and the towels within the pack are used to dry the hands. There are 2 towels, one for each hand. One side should be used for one side of the hand and forearm, and the other side for the other side of the hand and forearm. And the same procedure is repeated on the other hand. Following the end of this, the towels are discarded. Again, if during this time the hands touch any non-sterile area, the entire procedure should be begun again.